Welcome to Fun with ECGs. "30 seconds to look for evidence of ischemia." You may have noticed some elevation in the anterior leads. What do you think of that elevation, and what do you look for next? Things like reciprocal changes, territories, Q waves, and loss of R wave. Rate 66, sinus rhythm, normal axis, normal QRS duration. This ECG shows early repolarization in the anterior leads. This is also known as high takeoff. The more technical term is early repolarization, but that's maybe a little ironic given that it probably has nothing to do with early repolarization anyway. It's very important to look for any evidence of reciprocal changes. It's important to look to see if there are Q waves or loss of R wave or any T wave inversion or T wave abnormalities, because it's essential to differentiate this from ischemia, and symptoms are obviously also key. If you have a patient with typical symptoms of ischemia, you would need expert assessment in order to assess is this early repolarization or ischemia, and maybe an echocardiogram or even a coronary angiogram. How else can we do it? Well, if we look at the morphology of these T waves, which tend to be large in early repolarization, they tend to be symmetrical. If we look at the J point, it's nice and clearly defined. You can see where the QRS ends and the ST segment T wave starts. And also look for a concave ST segment into the T wave peak. Contrast that. So this is an ECG of which is within normal limits for the patient. A previous ECG for the patient would be very useful for comparison, and we see early repolarization in the anterior leads. If we contrast that with an ischemic ECG, we can see that the T waves are not clearly symmetrical. The ST elevation is convex rather than concave, and the J point is much harder to clearly define. The ECGs have Q waves or marked loss of R wave. You can see a very, very small R wave, so they're not technically Q waves here, but you've got a lot of loss of R wave. Interestingly, in this ECG, there isn't any ST depression, and actually this patient had just spontaneously reperfused, and the ST depression had cleared up, but the ST elevation hadn't yet cleared. So important to differentiate ischemia from early repolarization. Thanks for watching.